My name is Dr. Peter Gichuhi. I'm a reproductive health scientist, but I'm also currently privileged to be the Director General or the CEO at the institution, and I want to welcome you. Now, KIPRE is Kenya Institute of Primate Research. This is a biomedical research institute that has a mandate of improving human health by ethically utilizing non-human primates. So we have a mandate to improve human health, but we do all our researches, whether you're talking about the drugs, vaccines, or diagnostics, or medical interventions using monkeys. And the reason for this is because monkeys are very close to humans. So that when you look at any drug, the way it's going to behave, or a vaccine, or intervention, the way it's going to behave in a monkey species is likely to behave the same way in human. And we are at the Ministry of Health, State Department for Public Health and Professional Standards. We believe in using science to address human health challenges. And we are primate center. And obviously, snakebites don't fall in the category of primates because they're reptiles. But because we believe in using science to address human health challenges, we identified snakebite as one of the major public health of concern. And just to give you some basic statistics, in this country, over 20,000 Kenyans are bitten by snakes. And we have about 8,000 who suffer permanent disfiguration. Now, currently, all the antivenoms that are being used, because when you're unlucky to be bitten by a snake, what you are administered with to manage that is called an antivenom. Now, currently, all the antivenoms that are being used in the market are either from Europe or in India. The challenge with that is that because they have not used the local venoms to develop the antivenom, because you use venom to develop antivenom, the efficacy rates or how effective those antivenoms are is a challenge because they are very low. And because of that, you end up using a lot of the materials, and that has an implication in terms of the cost. So what we want to do is to use our own venoms here from our snakes and improve the efficacy rates and therefore reduce the amount of the material that you use to manage the snake bite. I want to appeal to the Kenya government and African governments to really appreciate that a country cannot develop or industrialize without investing in research. And we learned from the COVID-19 pandemic that the countries that were able to manage COVID-19 outbreak were the countries that had invested in innovation, science, and technology. So I call upon the African governments, including Kenya, to put resources in research because that is the future of the world.